An eating concern is often used to refer to disordered eating behaviors, weight, exercise, and preoccupation with food. And you might hear this term being used interchangeably with disordered eating behaviors. And again, it's referred to unhealthy relationship with food or perception about food and weight. And so if you look at eating behaviors on a continuum, so on one end is a healthy relationship with food, and the other end is meeting the diagnostic criteria for eating disorders. I think in between, there's a lot of disordered eating behaviors. It might be preoccupation with food and body image, excessive exercise, or unhealthy dieting, things like that. So even if you're not meeting the diagnostic criteria for eating disorders, it doesn't mean what you're doing is not unhealthy. And so a lot of time individuals with eating concerns, their ability to function is often interfered with these concerns. So eating concerns team here is an interdisciplinary team, consists of like clinicians such as psychologists, psychiatrists, psychiatric nurse, primary care physicians from student counseling service, student health service, and the eating disorder programs from U Chicago Medicine Department of Psychiatry. It's typically a session or two of the 45 to 50 minutes of clinical meeting with a member from the eating concerns team. And in that time, we will be asking a series of questions related to personal history of any eating concerns, current information of like nutrition, relationship with exercise, and also any related issues of how you're functioning, any family history, things like that, so that we could make assessment of like how you're doing overall. So the goal of like an eating concern assessment is to get you connected to the appropriate level of treatment. So if you notice that your overall ability to function is compromised because of eating concerns, like preoccupation with food or exercise, then I will really encourage you to consider seeking help. If you have someone that you've been working with, a primary care doctor, a therapist, or a psychiatrist, I will encourage you to talk with and consult with them about would I be a good candidate for such an assessment. If you're not currently working with any provider, feel free to directly consult with us, and it will walk with you through what that process might be like, where to even need one. And I also will say, understand that eating concerns such a complex issue. A lot of time it does come up with some of the co-occurring mental health concerns like anxiety, depression, or some trauma history. So it is definitely not just about eating or not eating, so it's not helpful to say you just stop eating or why don't you just eat more. It's also not helpful to just watch someone to stare at them when they're eating. So understanding that this is a complex issue and it does take time to work through these issues, so normalize this process. So if you are concerned for yourself or someone else who might be struggling with eating concerns, please feel free to reach out to Student Counseling Service or visit our website for more information.